So I'm going to go ahead and slow you down a bit and then have you turn around backward. And we might even increase the jets just a little bit. How are we doing there? That's a little push up for your quadriceps. And I'll have you stay just like you are there. You want the blue dumbbells? These ones right here. Let's do singles. This little exercise does a lot for improving Michael's rotational stability. His foot is planted to the treadmill. His upper body is creating rotational forces. And I think it has done quite a bit to prevent Michael from having falls or sprains in the ankles when his ankle musculature was weak enough that it certainly could have done so. Lots of repetitions. Okay, when you finish 15 on this, we'll turn and do the same thing from the front. Okay. It's turned up a little bit. You got 53%. Good. And singles. Good. Is that 15, I think? Yep. Arm swings. Good. So let's try to lead with the heel. Keep your feet straight ahead if you could. And use this, if you can go a little hands-free here, that'd be perfect. Good. I think this exercise is the reason Michael's hip abductor strength went up to a 5 out of 5. It works both sides beautifully. It's working, in this case, his right leg actively, but his left leg has to stay planted against those same forces. And so it's working as well. So better than just lying on the side of a table and doing hip abduction. Okay, as little of your hands as possible. A little hamstring curl. Yeah. And how about if you alternate those? That'll give you a little shift of your weight from one side to the next. Good. Very good. So we could do one more round here, and if you'd like, if you do them over here, we can put on that side jet. So you're kicking against that side jet. That's Michael tends to do one set or so over here of the lower extremities. Same exercises: hip abduction, adduction, and flexion extension. When you finish this round here, we're going to try just a squat pull. Nice, easy stretch for your knees. And we've used this squat pull both for pain reduction for some patients with lumbar pain, as well as just going through body mechanics of how one might rise from a chair. It doesn't build much strength. It does a nice job for Michael on maintaining his mobility of his knees.
Being able to stand and get directly straight up faster.
Yeah.
That's the key.
It's been good practice for you. Very good. And then how about some calf stretching? We'll do that over here. And again, remember we had 2 degrees or 3 degrees of dorsiflexion when Michael first began, and now he has 10, and it's, as far as I know, unless Michael's been doing a good job of stretching this at home, I think it's just from doing this stretch at the end of his workout. Look on his last progress report. His knee range of motion and strength have improved. Regarding symmetry and muscle strength, Michael's hip flexors, his psoas muscles, have improved from a 4- bilaterally to a 5. His quadriceps have improved from a 3+ on the left to a 4 on the left. His right quadricep was weaker at a 3- and presently is a 4-, so it's up a grade. Anterior tibialis strength has gone from 4- out of 5 to bilateral 5 out of 5. Extensor hallucis longus has gone from a 4- out of 5 to 4 bilateral 4+ out of 5. Hamstrings have improved from a 3- out of 5 to a 4- out of 5 on the right, a 4 out of 5 on the left. The gastrocsoleus muscles went from being unable to perform even a double heel raise to presently able to perform 10 single heel raises, both on left and right. Hip abductors have gone from 3- out of 5 to 5 out of 5. Range of motion, knee extension. Michael presented with a 25-degree knee flexion contracture when I first saw him. Presently, he has 0 degrees, no knee flexion contracture at all. Dorsiflexion was limited to 3 degrees bilaterally. When we first saw Michael, today we have 10 degrees bilateral. And again, at least 90% of our treatment sessions have been spent in the water, and so we've done this without doing manual therapy to restore knee extension. It's solely from home exercises that Michael's performed as well as the pool work. So it hasn't been especially fast, and yet the change has been consistent and steady for strength, and then the functional mobility has been rather dramatic. You know, going from taking 10 steps to, with maximum use of both arms, to now walking with a single point cane. And now Michael's back to driving independently, not requiring the assistance of his wife for getting around and going back to work.